So we just finished treating Diana very similarly to Certina. She had that pattern that we name posterior glide of the sacrum, in which the sacrum acts like it's posterior. That's what you told me yesterday. And you had a loss of accessory motions throughout the pelvis, rigid upper T3-4 area, and rigid upper cervical. And now I can get a little bit of inferior mobility on the sacrum. I can spring on the sacrum. I can see your heels bounce, the right more so than the left. Inferior glide through the ilium. I'm starting to think there's some other unilateral pattern on the left side. It's not quite as free on the left side. Okay. I'm going to spring up in the thoracic. And I'm not finding that restriction. I'm on the ribs now. Again, not finding it. Let's have you lie on your back, please. So here's posterior rotation. And here's side glide. So the structure is more mobile now. I'm going to test C1. Good. A little bit of mobility there. I need to move your hair a little bit. Definitely more. Just relax. It is more, but it's not like it's normal. Okay, so you still have some resistance up there. Traction is very nice. And springing on the mastoid is freer. It's not normal, but it's freer. Side bending, you have some mobility. But for reasons that I don't know at this moment, and I think your first rib is just insanely compressed. I can't create any mobility here. And your body looks very constricted at the level of the clavicles. So there's more work to be done. The purpose of our filming was to demonstrate that pattern called posterior glide of the sacrum. So I'm going to have you get up, even though in the clinic I would be doing more things with you. But let's go ahead and see what we accomplished by improving lumbopelvic mobility. You want to walk around? Tell us your thoughts.
Well, I normally wear a heel lift, so
Okay.
put my shoes on or just walk without?
You can put them on.
I feel a difference even without the heel lift.
What is that difference?
Normally when I'm walking, I have to like tuck my pelvis because this is sticking out, so I don't feel like I have to self-correct that. Yeah, it feels just a lot better.
Anything more specific? You say it feels a lot better, but what is that?
I mean, normally I have to have the heel lift to feel like I'm walking normal. I guess it's just more movement. I don't feel this area pulling.
So you feel like the right lumbopelvic region is freer?
Yes, absolutely.
So again, it's interesting, third person, that we're doing a bilateral treatment, but getting a primarily unilateral improvement, at least subjectively.
Yeah.
With my spring test, I know you're moving better on both sides, but interestingly, your left side still has some rigidity, some tightness. We found a pattern in the knee we need to treat. That might be feeding into that. But
yeah, this is not sticking out. I could tell when I was laying on the table. Normally,
what is not sticking out?
the sacrum. Normally,
the sacrum.
I have to normally put like 2 fists here if I'm laying on a table. At the beach, I have to dig a hole to put this.
That's interesting.
Yeah,
I know where you've been.
Yeah. So.
You can't hide, right?
No. Yeah, if you see the little dig out
Yeah,
spot, that
you're
means
not far.
that was there. Yeah.
Okay, good.
Yeah.
Well, it's really interesting. We just know so little about this pattern. I know how to identify and treat it, which is pretty simple and common sense and straightforward, but we don't really understand what it is. You know, we need more research, and thanks for letting us film you. I appreciate it.
Appreciate it.
Yep. Okay.